Federal guidance surrounding the COVID-19 vaccine is shifting. There's confusion between what the federal government is saying and what states are recommending. Sarah Wilson spoke with health officials. She joins us now with more on this story. Good afternoon, Sarah.
James, good afternoon to you. The CDC says the COVID shot should be given on, quote, an individual-based decision-making, or rather personal choice. On the other hand, Pennsylvania says almost everyone should get the shot. The state is going off of guidance from medical groups like the American Academy of Pediatrics and the American Academy of Family Physicians. Both recommend everyone 6 months and older get the updated shot, or almost everyone, I should say, because of course there are exceptions, which is why you should always talk with a healthcare provider or your pharmacist. This confusion, though, has caused some skepticism, especially following certain vaccine mandates, state vaccine mandates for employment at the beginning of the pandemic. I asked the Pennsylvania Health Secretary if that's caused some mistrust.
We're looking forward and making sure we're focused on what's happening right now. And again, history will serve itself, right? What we are trying to do is make sure people understand what evidence is out there to support the best decision making.
So if you don't have insurance, you can expect to pay upwards of $200 for that COVID shot. There is a bill in the State House that would require insurance companies to pay for the vaccines, James.
And Sarah, I mean, you can really see why people are confused if you have the federal government saying one thing, the state government saying another thing, and then people are telling you to do your research, and
Right.
The research says whatever you can find.
Yes, and that is perhaps the perfect way to put it. We've covered this for so long, James, and I was a little bit confused about what each individual person should do. And the bottom line right now is the guidance is still a little bit fuzzy depending on where you're looking. The federal government is saying to follow the CDC's recommendation, which is based on personal choice. The Commonwealth is saying no, follow the American Academy of Pediatrics and the American Academy of Family Physicians. So at that point, it is kind of just trying to figure out which source you'd like to look farther into is the best way I can put it.
Absolutely. Sarah Wilson, thank you for breaking that all down for us. Really appreciate it.
Hi, I'm Eric Finkenbinder from ABC 27. We're excited to announce the new ABC 27 News Plus app. Live stream newscasts or watch content on demand. This is different than the ABC 27 app on your smartphone. You can check this out at home and it's very easy to use. With a Fire Stick, go to the home page, scroll down to search. From there, enter ABC 27. Move over to the apps and there we are. Click the icon and install. It's just that easy.